What do you think about when I say plantar fasciitis? How about hammer toes or bunions? Are these foot issues that you have experienced? I have had plantar fasciitis and a little bunion. So I've had my share. These are things that can really impede our performance, our walking, our exercise. And we definitely don't want to let these foot issues slow us down. So, what can we do about it? Well, I'm welcoming back to the podcast Dr. Jen Perez from Gait Happens, and she's the expert, and she's going to talk to us all about what we can do with our feet to make sure that we're optimizing them for good health. Dr. Jen is the co-founder of Gait Happens, a global education company with a special interest in lower extremity biomechanics. She's also the co-owner of Kinetic Chiropractic in Lafayette, Colorado, where she helps patients of all ages, backgrounds, and athletic abilities. Dr. Jen has lectured to the healthcare practitioners across the U.S. and internationally as both an educator and a clinician. Her mission is to empower as many people as possible to take charge of their lower body health so that they can get back to doing what they love. And that's exactly what I just said. We just want to make sure that our feet are as healthy as possible because we know that when they are in pain, it can really sideline us. So I look forward to this conversation. Let's welcome Jen to the podcast. All right, folks. Well, thanks so much for joining. And today we're here with Dr. Jen Perez, and she is definitely the foot specialist that I go to. She's been on the podcast before and a wealth of information when it comes to optimizing our foot health. And if you've had something like plantar fasciitis or a hammer toe or bunions, you know the pain in the foot that can be. And, all you want to do is make that feel better. And sometimes we don't know what to do. Of course, we don't want to stop moving. So how do we go about dealing with all those things is the question. Well, today we're going to ask our special guest all about those things. So Jen, thanks for joining us again.
Thank you so much for having me. I mean, you made an excellent point because your feet carry you through life. And so discomfort and pain in our feet can be really life altering, whether that means that we're not doing the activities that we love or oftentimes not planning the trips that we want to because we're afraid of having to walk. So I'm really excited for this conversation.
Yeah, speaking of that, someone just posted in our Facebook group and said that this is kind of funny, but I totally get it because I did the same thing. She says her first experience with plantar fasciitis was going to Europe and deciding to wear cute shoes instead of sneakers. Have you heard of people doing that? I'm sure you have.
All the time. I mean, I can't tell you how many patients come through my doors and the story starts with a trip. And I think that's actually,
Ah,
it really falls into exactly what I wanted to talk about with kind of the integrity of soft tissue and especially with going through menopause, because oftentimes injuries happen with one of two scenarios. Either there's an increase in load. So, for example, if on average you're taking 6,000 steps a day and then you go to Europe and now you're taking 16,000 steps a day,
right.
and your tissues just aren't prepared for it. It's essentially like going to the gym and walking in on day one trying to squat 200 pounds. It's just not what our body is prepared to do, and that oftentimes leads to injury. And then the flip side of that is we'll also see people who get injuries doing the same thing they've always done, but now they're starting to go through menopause or just start to get older, and our tissues change and can't tolerate the same loads unless properly trained. So it's like I've done the same 5 mile run for 10 years, and now all of a sudden I have plantar fasciitis or Achilles tendinopathy. And it's kind of that other conversation that has to happen is the load and the tissue quality.
Okay, I love the differentiation between that. That makes so much sense because, yes, in your younger years, like my first time of getting plantar fasciitis, I told this story with our first podcast together, but it was wearing some flat boots, cute boots, albeit, but flat and narrow, pointed. So my foot was in a position that it normally didn't, go into regularly. And then I was on it for a volume. So it was all day through the Olympics, walking through the village, and yeah, it just got really bad and then it was really bad. But I was young, so it wasn't menopause related. But now we're seeing that so many women in menopause, perimenopause even,
Yeah.
are starting to develop foot conditions. So what is the mechanism? What is happening in our fascia even
Mhm.
that is causing some of these issues to occur?
Such a great question. So let's talk about the relationship between the muscles and the fascia and tendons to start off with, because then it'll make a little bit more sense. So when you think about the muscles and the tendons, think about a trampoline. The muscles are the black mat of the trampoline. They should be stiff, and if they're strong, right, they just kind of hold their position. And then the tendons and the fascia are the springs.
Mm.
So, with our movements, whether we're talking about walking, jumping, running, really any movement, our body is designed to be elastic. And in order for that elasticity to work, we have to have strong muscles, so that stiff mat. And we also have to have stiff, in a good way, stiff tendons so that they can act as the spring.
Right.
So, what happens over time, really starting around the age of 40, is we start a natural process called sarcopenia, which is where the muscles start to dwindle a little bit unless we're really proactive in maintaining that muscle strength. And this is where, again, if we've been doing the same routine forever and ever, it's not going to have the same effect as it had before once
Right.
we start seeing this process. And so, with that, if you used to have a really strong muscle that worked really well with the tendons, and now the muscle is starting to lose some of that strength and that ability to hold tension, it's going to change the way it interacts with the tendons and the fascia, which is why it's so much more common in older populations, older being honestly anything over 40, right, is when we start to see more soft tissue related injuries versus under 40 is more typical to have bone related injuries.
So even the amount, so we talk about sarcopenia a lot, and I like what you said about having to shift things up, right? What you've always done is no longer working. So ergo, that means we have to approach it a little bit differently. So what are some of the different ways that we are approaching? Let's just take plantar fasciitis
Yeah.
specifically in terms of treatment. What are we looking to do if we have it? We find that there's that pain. Maybe you should start by defining it and then what we could do if we do find that we have it.
Great question. So, of course, I've got my foot model per usual.
So if you're listening on the podcast here, make sure that you head on over to YouTube if you want to see Dr. Jen's foot models, because this is really helpful. I find the visual to be super beneficial. Okay, go ahead.
Absolutely. And I'll try my best to describe it as well. So, what I have in front of me, I've got my foot model that shows all the muscles underneath. And really, underneath the center of the foot, there's one really important muscle here. This is called your flexor digitorum brevis. FDB for short. I'm not going to expect you to remember all of these muscle names, right? But FDB is best friends with the plantar fascia. It's a very simple relationship. The two of them together are the trampoline of the foot, right? Going back to that same trampoline analogy. So whenever we take a step, our foot should be able to push off and spring forward. That's how we get propulsion. But with plantar fasciitis, oftentimes what we're seeing is the strength of flexor digitorum brevis is not there. And when we don't have the strength of that muscle, just like we just talked about, we're going to put more strain on the soft tissue instead. So we
Mhm.
start to cause irritation of the plantar fascia or excess strain on the plantar fascia. And over time, it starts to thicken. It can start with inflammation, which is why it's commonly known as plantar fasciitis. But over time, when it becomes chronic, and it can actually become degenerative, where we call it plantar fasciosis. And
Okay.
so, the terminology aside, really it's irritation or overstress on that plantar fascia. So, coming back to what do we do about it? Well, we strengthen the muscle.
Yeah.
And, a lot of people go through life not having to think about strengthening their feet. Now, there's a lot of people that do end up in this arena because they've had injury in the past, but so many people are like, I've never had foot problems, and now all of a sudden I have plantar fasciitis. I've never had to strengthen my feet before. Why do I have to do it now? And it goes into that same conversation of, if we're not seeing the strength that we need, we're going to overload the tendons and the fascia. So really being more proactive with foot strength would be my short answer of what to do about plantar fasciitis.
Yeah. So it sounds like that muscle needs to be strengthened in order to prevent, right? Okay. So let's talk about some of the ways that we can strengthen that muscle in our foot.
So I have two options or two kind of beginner exercises, if you will, for strengthening FTB. So the first one is really more about finding this muscle because,
Hmm.
I'm not numb to the fact that most people don't work on their foot health or their foot strength as much as I do, right? So let's just find the muscle to start with. So everyone that's listening, all I want you to do is just have both feet flat on the floor, ideally barefoot, but if not, you can do it in your shoes. And I want you to lift up all 10 toes, spread them out as wide as you can, and then reach them out and press them down to the ground. So really long, flat toes. You're going to press those down into the ground, hold that press, and then just barely lift your heels up. And if you kind of just float the heel just a little bit, you should start to feel this burning, this fire that builds right under the center of your feet. And that is flexor digitorum brevis.
Okay. And wow, I'm doing it with you as you're speaking it. A little bit of vastus thigh muscle activation here as well going on.
Absolutely.
Okay, that's something that's
Absolutely.
super simple, right? You
Yeah,
can do that sitting at your desk. You can do that watching television, scrolling on your phone, just open, spread, press, slight lift. Okay,
exactly. You got it.
I like it. That's a good one.
So, and the
Oh,
really the key there too that I find different than a lot of, maybe internet exercises that you might find is a really common one that's out there is like towel scrunches or
yeah.
picking up marbles, that kind of thing. And the key difference is with those exercises, you're curling the toes, which is something that we tend to already do a lot. We already tend to grip our toes a lot as a common compensation. The difference is when you really lengthen and press the toes flat, that's when you get that flexor digitorum brevis muscle.
So say we weren't as proactive and we didn't do some of these exercises to strengthen that muscle and we've developed plantar fasciitis and now we want to treat it. Now, I've heard you can grab a golf ball and be rolling over it, but if you have fasciitis and it's inflamed and sore, is that what we want to do right away? Or what is the protocol if we find we have this acute onset of fasciitis?
I like the idea of rolling a ball, but a golf ball might be a little bit too aggressive just because it's very hard. It is a good size for the foot, but we actually came out with just a couple months ago, we came out with a brand new foot health kit at Gait Happens that has very simple tools that you can use to improve your strength and mobility for your feet. One of which being this little ball here. So it's a small rubber ball, probably between the size of a golf ball and a lacrosse ball, but it has these nice little textured bumps on there. And it's more pliable than a golf ball. So, and if you don't have this ball, that's fine. Use any ball, but something that has a little bit more give than a
Mhm.
golf ball.
Mhm.
But rolling the foot in general, I do like because it offers a little bit of that massage. It gets a little bit of the blood flow going, and then also kind of speaks to the brain. You get a little bit more neurological connection. So it's a great thing to do actually before you do exercises because it really wakes up the connection between your foot and your brain for then to do some strengthening as well. And that's where the magic happens. The
Mhm.
relief might come from rolling a ball, but the magic happens when you start to add strength. So starting with that, toe press exercise we just did is a great place to build that connection with the muscle, but then you need to add resistance. Just like when we're talking about muscle mass, we have to add load. Muscles in the feet are exactly the same thing. You have to add load. So one of my favorite things is to grab a resistance band and you can actually loop the band around the front of the toes and then press the toes down into that band. And now you actually have resistance against that same flat toe press where you can build up some really good strength.
Okay, so you're standing or sitting. You take
Yep.
that thicker resistance band, so it could be like a mini band or a TheraBand. Wrap it around the outside four toes, not the
Yep,
big
you got
toe.
it.
Planting the
Totally.
big toe in the ground and then just lifting and then using that counter resistance.
Yep.
Okay, yeah,
Absolutely.
that's a great
And I don't
idea.
know if there's show notes on the video as
Yes.
well, but I'm happy to send over a video of that exercise too.
Oh, great. Yeah, for sure. We'll add that to the notes below this as well. Say we have acute chronic plantar fasciitis. It's not good. We haven't walked in like 6 months. All you want to do is get back to playing pickleball and walking. What sort of treatments are we asking the podiatrist or the chiropractor or whoever we're seeing? What are we asking for?
I mean, this is again, it's such a common story that I hear with my patients and I feel it so deeply because it really does impact your life. it kind of just think of it as adding layers, right? So the one exercise is like, if you just want to be preventative, let's get a little bit of activation in that muscle. The second one is, okay, let's get a little bit of relief and strength in that muscle. The third is you're going to still do those same two exercises, but let's add a little bit more in here for relief,
Mhm.
for something to, if you think of it as like, a crutch, if you will, but essentially something to keep you moving while you're injured. That's where we want to intervene a little bit more. So things that you could do there, there are some studies that show that you could do a steroid injection for plantar fasciopathy. I'm very, very cautious there. I typically only use that for very severe cases.
Mhm.
And I'm also very cautious about multiple injection protocols because steroids also are degenerative on soft tissues. So that's a really fine line. And it's something that I kind of keep in the back pocket of if we need an advantage to get us over the hump so that we can really then work on strength and mobility, that's then when I'll refer someone for an injection. But most of the time, you can use things like footwear, for example, where normally, and I know we've talked about footwear in the past, but
Yes.
normally I prefer to be in a minimalist shoe. So something that's basically like wearing a sock because it makes my foot do the work. And that's how I keep my feet healthy, talking about keeping up that strength. But if I'm having a little bit of discomfort, or if I am in so much pain that I can't get to my mailbox, it's okay to use something with more cushion to help you get there in the meantime. But the caveat with cushion is it's a long-term, short-term conversation. It's going to offer short-term relief, but if we rely on cushion in the long term, it's then going to weaken the feet, so we can't not have the cushion. So that's my little caveat there. So again, if you go from like awareness to acute to chronic, it's the same conversation. It's just
Mhm.
let's add a little bit more to keep you moving while we build that strength and that connection.
Okay, great points there. And since you have the shoes right there, let's dive into that conversation about the evolution of footwear. You know, goodness, we've seen shoes with the thickest soles ever, right? Like really thick, higher heels, deep slopes, lots of cushion, lots of padding. The Hokas are known for there a lot of foam underneath there to support. And yet now the conversation is coming out that minimalist shoes are probably better for overall foot health and for the long run. So, as you said, it might be beneficial now because it maybe makes your knees feel better or your hips feel better or your feet. And yet, you're not doing anything to support foot health because you are couching that foot in every bit of padding. It's like it's living in a bubble, right? It's the
Exactly,
boy in the
exactly.
bubble, but that's the foot in the bubble. So let's talk about your recommendations on shoe choices and what is best for walking and for training.
Perfect. So let's start with the cushion conversation since that's kind of where we're starting. So with cushion, I like to think of cushion as use what you need for the task. And I'll add to that, use as little as you need for the
Mm.
task. And
Mhm.
so if I'm just honestly, like I'm barefoot right now. So if I'm working, if I'm in my house, I'm barefoot. Our feet are designed to handle our bodies. So we should be able to move and function barefoot throughout the day. Now, if I'm going outside and I don't want to step on glass, I'm going to then take my minimalist shoe that lets my foot still function as if it were barefoot, but protects the sole of my foot. The cool research that's been coming out with minimalist footwear is it's the first time that shoes have been shown to strengthen your feet. And I think it's because we've become so detached from our feet from wearing really thick cushioned shoes that are doing the work for us, that by stepping into less shoe, if you will, it makes your foot do more work. So there's actually protocols out there of starting to increase your step count slowly. Wearing a minimalist shoe will actually increase your foot strength as much as a foot strengthening protocol, which is crazy.
Yeah, I think that's a good point that you just made too. She said slowly, right? So you're not buying the brand new shoes and saying, I'm doing 10,000 steps today in my brand new shoes, because that is going to be trouble, right?
Absolutely. And that goes back to that same conversation of you don't go to the gym and try to
Yeah.
squat 200 pounds on day one, right? The muscles under the feet have to grow and adapt just like the other muscles in the rest of our body. So starting with even 10 minutes, 10, if you're especially if you're in your shoes 24/7, try going barefoot for 5 minutes. Try like starting your new shoes for 10 minutes, 20 minutes, and then build up the tolerance there over time. You can also, there's kind of two ways to do that. You can either go to minimalist shoes and build up slowly with time, or you could find a transitional shoe, something that has less cushion than you're used to, and get used to that shoe before continuing to step down that spectrum.
Hmm. Yeah, it's interesting. I live in Canada, and we lived in the States for 2 years. And while we lived there, people would come to our house and then just wear their shoes in the house. And we never did that in Canada. Like we are shoes off at the front door. I know not everyone in the States does that, but it was, we were shocked. We're like, okay, I guess we can just wear our shoes in. But I do that as well. I am a total shoe off in the house. I work out with my shoes
Mhm.
and then I take them off as soon as I'm done the workout. And yeah, that's a really great first place to start, right? A lot of people have really cushy slippers. I know that we get them for warmth as well in the winter, but sometimes people wear them all summer long, right? So that's a good place to start with that.
There's one other point I want to make on cushion as well when it comes to the neurology of the feet, because I think that's also a really important conversation as we age, is our sensitivity of our receptors actually goes down. And that's totally normal. It's a completely normal, healthy process. But what that means is it takes more sensation for our feet and our brain to know where we are in space.
Right.
And so the more cushion we're putting underneath our feet, we're basically putting blinders over those receptors that are already starting to feel less than they have in the past. And so this can also start to contribute to decreased balance. It can contribute to fall risk as we age into later years. So this is a really important conversation to have, not just around footwear, but around the sensitivity of the nerves in the foot itself.
Okay, so interesting thing coming that just happened to me last week. We're creating a new program coming out. It's called Motion Mastery, and it's got balance, stability, mobility, and flexibility. So we're doing all the things. I've got a strength and conditioning coach, Andrew Lacurdo, coming in doing it with me. So I was demonstrating a squat pattern exercise, and he noticed that my big toe on my left foot just kept coming up. Actually, it was a squat balance pattern, and I could not get that balance on the left side. And I was wearing socks. We were barefoot, or sorry, not barefoot, but sock feet. So no shoes. And I couldn't believe how imbalanced I was. And when he said that toe keeps coming up, I didn't even notice. I was not even aware that it was coming up. So, of course, then I was rotating, externally rotating to the left side, and it was really throwing off my balance so much. So when he did a little exercise with me, had me step on one of those resistance bands, and he's like, okay, now go into a lunge position, push the toe down hard, spread the feet, push the toe. And he put some tension on it and pulled that resistance band. And she's like, yes, you're doing it
It's one
right,
of my
Coach
favorite
Andrew.
exercises.
And the tremendous fatigue that I felt in that foot, tremendous. And then up into my glute, I was
Mhm.
absolutely shocked. And I do have a bit of a bunion on that side. So explain that, Dr. Jen.
Tell me what's happening. I love that he did that. That's one of my favorite cues to use for people. I mean, if I was to focus on one thing about the foot, it would be the big toe. And the
Mm,
big toe provides about 80% of the stability of the foot. It's big for a reason.
mhm,
Yet, so many patterns and that we fall into involve unloading the big toe, whether it's chronic ankle sprains, whether it's pain, whether it's bunions, whether it's sesamoiditis or hallux limitis, arthritis in the big toe. There's so many things that can happen that can cause us to want to offload the big toe. But in reality, when you start to load the big toe up, it provides more stability. And then it also is going to engage that entire posterior chain because
mm,
flexor hallucis longus, which is the muscle that presses the big toe down into the ground, is part of the posterior chain that goes up the entire backside of the leg, all the way through our paraspinals and up into our head. And all of those muscles work together. So you're going to get more. Um, bang for your buck when the big toe is engaged, more stability balance wise. And then you're also, fun fact, if you want to throw in one more topic here, you're going to get reflexive contraction of your pelvic floor
Huh.
because there has been research that shows that there is synchronicity between FHL and the pelvic floor. So when one fires, the other fires.
Wow, that is interesting. I'm just instantly pushing my big toe into the ground, seeing if I can feel that in my pelvic. No, but that, I mean, clearly it's all connected. So usually they say when you have issues in the body, it's often two joints above or two joints below that specific area that's causing you grief. Let's go back to the big toe because I think it's really interesting how the movement of the big toe laterally can impact things and give us things like bunions, right? So last time we talked about bunions and bunionettes, but for those who didn't hear that podcast, can you explain what those are again? And then how do we train that big toe to stay put?
Love it. So different foot model now. We're looking at our bony system of the foot. So with bunions, what you're looking at is the big toe starts to drift towards the other toes. So we get
Yeah.
this angulation called hallux valgus. And then as that big toe starts to drift this way, the first metatarsal is also drifting the opposite direction. So it really creates this bowed angle at that first metatarsal joint. So what you'll start to see is on the side of the foot at that big toe joint, you'll start to see a bump develop. And that oftentimes can be red, inflamed, painful, especially when walking, because as you can see for those that are watching, with that angulation of that joint, now if I go to take a step on this joint, let alone 6 to 10,000 steps on that joint, it's essentially like opening and closing a crooked door over and over and over again, which is going to cause irritation in that joint.
Mhm.
So, one of the best things that we can do is work on realigning that toe. And there are definitely conservative measures that you can use to do this, right? One of the things that we love to use is toe spacers. There's
Yep.
a million different kinds of toe spacers out there. These are the ones that we like because they're flat on top and bottom and they don't have a loop around the big toe, so it doesn't feel as constricting. But what this is going to do is you put it between the toes and it's going to be like a bowling bumper, if you will. It's just going to kind of guide you to keep that big toe in a straighter position while you're actually walking and moving around.
Hmm. Yeah, those can be super helpful. And do you recommend wearing those within the shoe? Do you recommend just, and how long per day would someone wear those?
Again, they're going to be uncomfortable when you start because a lot of times the tissues between the metatarsals and the toes also becomes tight because bunions don't happen overnight, right? Like this is something that happens over years and years. And so those tissues start to become really tight and restricted as well. So when you put those toe spacers in, it's going to be uncomfortable when you start. So again, starting with that kind of 20, 30-minute mark and then building up. But you can absolutely build up to a point where you're wearing them all day long. And if you're in footwear that has a nice wide toe box that allows your toes to spread, then you can wear them in your shoes as well. You're always going to get more bang for your buck when you're wearing them on your feet versus when you're just like watching TV or even if you're sleeping, because that's just going to give you kind of that passive stretch versus
Mhm.
helping guide your toe position while you're on your feet.
Yeah, perfect. And I will link some of those in the show notes below as well for those who are interested in that. But yeah, the wide toe box is important. One of the things that Dr. Jen said on our first podcast, which just shocked me to high heaven, was that sometimes when we stick our foot into a nice, glorious little high heel that is the shape of a pizza, that's what the toes are doing, right? The toes are crushed together for a long period of time, however long you're wearing them. And when we were in our 20s, we'd dance all night in those darn things. No wonder we couldn't walk the next day. But how important is it that we try to look for shoes that have the wide toe box as opposed to that angle? And can we ever wear the angled shoes again?
I am all for like meeting in the middle, right? Meeting everybody where they're at. In an ideal world, no, we would not wear the pizza shaped shoes because there's no functional reason we should be wearing those shoes.
Yeah.
right? Like the second that you put your shoes or your foot into a shoe that is narrower than the shape of your foot has to conform to that shape. So whether we're talking about a pointed high heel or whether we're talking about a more traditional like exercise shoe, but when you take out that insole, one of my favorite tests to do is to take
Okay.
out the factory insole of a shoe and then put your foot on it and then see where your toes lie. Because if you do this and then the insole is shaped like a triangle, even in an athletic shoe, which I don't like to name drop, names, but think about your big shoe brands, right? If your toes are then going over the edges, then you know when your foot is inside that shoe that it has to conform. And that's going to change the alignment of your toes. It's going to change the muscle engagement because we're supposed to spread our toes in order to engage the stability. There's something called the tie bar mechanism in the foot that makes the foot stable when it spreads. And then you're not going to get the muscle contraction at push off, which is needed, going back to that muscle tendon relationship, to not overload the fascia. So it's not just the toes that we're worrying about with the toe box, it's also the function of the foot. Because if I can't engage those muscles, now
Hmm.
I'm going to overload my plantar fascia. And that's one more reason why we might be seeing that plantar fasciopathy.
Hmm. I feel like you're going to say yes to this, but what are your thoughts on training barefoot?
I love training barefoot. Yes, you're,
Hmm.
you're totally right. I love training barefoot for multiple reasons because you're going to be more stable, you're going to feel the ground, you're going to get more muscle engagement from the foot all the way up those chains that we talked about. Because it's not just the posterior chain that the foot is connected to, it's the anterior chain, it's the deep front line that goes up into the diaphragm, up into the pelvic floor, the adductors. It's all connected and grounded at the foot. So I think the more stable you are, the better off we're going to be. I also wanted to go back to your question that I didn't successfully answer earlier, which is can we ever wear junk food shoes, which is what I call them? And the answer is yes. The realistic answer is that's why I call them junk food. If you think about it like nutrition, if the
Yeah.
majority of your shoe diet is healthy and lets your feet function, then wearing heels at a wedding for a couple of hours is not going to just totally destroy your feet. You will
Yeah.
probably suffer for it that night and the next day, but hopefully not longer than that. So just think about those shoes as more of your junk food shoes versus your everyday shoes.
Yeah. So let's go into bunions again here. So we have the toe spacers. We're working on those to separate the feet to increase our muscle in the toes. Now, what if we have a real painful bunion and every time we put it in our shoe, it's causing pain? What are the treatments that we're looking to get with that?
So again, the toe spacers, it depends on the severity of the bunion, and pain doesn't always equal severity. So the pain can be, I have a patient right now who has some of the most severe bunion pain that I have dealt with, and you can barely see her bunion. And
Hmm.
so the pain doesn't always match the severity. Severity is measured by the angle of the bunion, and it's actually measured on X-ray via the angle between the two
Okay.
metatarsals. So it's how far has that metatarsal deviated this way.
Okay.
Now, mild to moderate bunions, based on the severity of the angle, can respond well to conservative things like toe spacers. So even if the pain is severe, if it's a mild to moderate bunion, my first step is toe spacers. My second step is always strength, because
Mhm.
just like we have the muscles underneath the feet, we also have a muscle on the side of our foot called abductor hallucis, which is the muscle that brings the big toe away from his friends. And we can strengthen that muscle. But I'm going to caveat that with most often those with bunions are quite distant from that muscle. So
Mhm.
rebuilding the neurological connection there is difficult. It is not impossible, and you can totally do it with time. But I
Mhm.
always like tell people up front that it is one of the most frustrating things is trying to reconnect with that muscle. And one of the easiest ways that you can do that is just like we did before with the lifting and the spreading of the toes, but with a little bit different focus. So this time, so go ahead and put your feet down again and then lift up all 10 toes. And then, especially for those with the bunion, focus on one bunion or the side that has a bunion. And I want you to think about reaching that big toe away and tapping it to the ground. Almost like if there was like a line next to your foot, you're trying to reach for that line and try to reach it away.
That is so fatiguing because I do have a bit of a bunion on the one side. It's not painful, but
Mhm.
it looks ugly and I don't want to have it. So I've got the spacers going, but yes, that lift, reach, and tap is fatiguing on that side.
Absolutely. And you might even get cramping, or you might even be listening to me going, that's impossible. I'm never going to be able to do that. My toe's going the other direction when I tell it to go this way. And that's
Truly.
that neural connection that I was talking about, where because we're so distant from that muscle, it's going to be really frustrating in the beginning, but keep talking to it. Keep telling it to do it because eventually you're going to get through and it's going to listen to you. And one of the things that I also like to do for that, just to add one more layer, is if you want to add either resistance or sometimes having a kinesthetic cue can be really helpful in rebuilding that connection. We actually design, these are actually our patented toe strengtheners. And that's exactly
Okay.
what we design these for is if you're familiar with like hand strengthener bands, this
So
is the
she's
same.
holding, if you're listening, she's just holding up like, what is that? What is
So
that?
it's literally like it's just a rubber band. It's actually not even rubber, it's
Yeah.
silicone, so it's latex free, but
With
it's
little holes for the toes.
yeah, a little band with holes for the toes. And then now you have a band that you can use
Great.
to strengthen spreading the toes. So
Great.
it can be used both. There's like three different resistances. So it can be used to increase strength progressively. Or, like I said, some of my patients that really can't connect with that muscle, it can be helpful to have something to try to press into.
Yeah. With summer coming, people are going to be going toward the flip flop and I- sandals, flip flops. What are your thoughts on there? What are we looking for when we want to choose a brand that is going to be healthy for our feet?
Great question. So, flip-flops, not my favorite, but probably not for the reasons that you think. Because most people think flip-flops are not good because they don't have any support and they're really thin. Those are the things that I like about flip-flops. Because going back to our conversation,
Yes.
thin, flexible, no support makes your foot work. It's actually going to keep your foot healthy. What I don't like about flip-flops is the fact that you have to grip your toes to keep them on.
Right.
So the key to sandals is just find one with a heel strap. And it doesn't, I mean, it can be like your rugged athletic heel strap sandal if that's your vibe, but it doesn't have to be. I have some really cute sandals from Bilenka, from Field Grounds. There's lots of options out there that are more stylish that just have a little strap around the heel so that you don't have to grip with the toes or lift the toes. So some people do the lift instead and then end up with pain in the top of the foot or the pain in the top of the toes. Either way, we don't want those things because they can both contribute to hammer toes.
Okay, and let's just jump into that. What exactly is a hammer toe? How do we define it? And then what can we do if we think that we have that?
So, hammer toes are a curling of the toes. Oftentimes, you'll see the toes start to lift up and curl down. And then, if the toes are in this position for a long period of time, that can actually start to become rigid, which is quite painful. Think arthritis in the toes and in multiple toe joints. So, number one, we have to figure out why are we curling the toes?
Mm-hmm.
Right. That's the first step. And that's the hardest step. And that's where we definitely want to lean on assessment from a practitioner because it could be that our feet aren't very strong. So we're trying to grip the ground to stabilize. It could be that, with pregnancy, right, we don't have a lot of core stability and our weight is shifted forward. It's really common to start to see toe gripping then. Or it could be that we're wearing sandals. So we start to lift the toes and grip to hold them up. So hammer toes are really common in people who wear sandals all the time. So there's lots of different factors as to why they can happen. But essentially, the two important points are they flexible? And then we want to make sure we restore the strength. So with hammer toes, if you do find that your toes sit in this curled position, the first thing you want to do is try to flatten them. Just use your
Mm-hmm.
fingers and just see, do they go flat? And it's okay if there's a little bit of resistance in there or stretching in there. You might even feel the skin stretching because it can get tight over time. But as long as it feels like it could potentially move, then we want to start working on it. You want to be massaging the tops of the toes, you want to be stretching the toes, massaging the bottoms of the toes. absolutely early intervention is key in
Mhm.
maintaining that mobility. If it has become rigid, where now we're talking about arthritic toes, that's where we might need to accommodate. We might want to use pads inside the shoe to help accommodate the toes, or there are hammer toe release surgeries if that's going to be the preferred method. So it just depends on kind of where in the journey we
Severity.
are. But
Yeah.
as long as we can restore mobility, then we can also restore that strength. And that goes right back to that same exercise of reach out those toes and press them into the ground. So you keep coming back to that same
Yeah.
exercise. So it just shows how powerful it is if you just
Yeah.
do a little bit for your feet.
Did you see that? Or maybe you guys posted it. I don't remember where I saw it even, but there's a tribe that is barefoot and their feet are just like total flat pancake looking feet and wide, 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 right? From living their life like that. And then they compare it and contrast it to our feet that are squished into shoes. And it's hilarious, the
And
difference.
look like diamonds. Yeah.
Yeah. Yeah. Look like diamonds and then big bunions and bunionettes and everything's popping out and zoiks.
Well,
Anyway,
the human
it
body
gives,
has always
yeah.
been good at adapting, right? Like no matter whether we're talking about like the whalebone corsets or whether we're talking about neck elongation or whether we're talking about foot binding, the
Right.
body will adapt to the position you put it in.
Sure.
But the problem is that we don't see that today's footwear is that constricting, but it
Yeah.
is.
Yeah. Yeah. If you want to name drop, I'm going to let you do that right now because I would like to know too, what are some of the top brands for minimalist shoes or sandals? What are we looking for? We're going to our local stores or we're buying online.
Yeah.
Let's have some names that you would recommend.
Absolutely. There's so many brands out there now. I
It's
mean,
coming
even
up.
just from
Yeah.
like, yeah, even just from like 5, 6 years ago, I feel
Yeah.
like there's like hundreds of new brands sprouting out every day. So if you do like dive deep, you can find so many, but some of the big brands that are out there. So one of them would be Vivo Barefoot is one of the most popular for really a minimalist shoe. I like Vivo Barefoot. Tolos is an American-based company that's similar, Tolos. And then something, I mean, truly, my most minimalist shoe is this. This is from Wildlings.
Those are
And
well worn there.
I mean, this is my summer shoe. I wear this without a sock and I literally just throw it on and it
Yeah.
feels like air. It's like, I don't know how they did it, but I call it the Mary Poppins shoe because it just feels like there's so much room in there. And
Yeah.
yeah, so super lightweight. But then if you're wanting something that's a little bit more stylish, like we're going for more like your casual look or even going into like elegated or business wear. So Bilenka is one of my favorite brands for that. They have everything from cute boots to loafers to
Oh,
more stylish sandals. So Bilenka, Feel Grounds is doing a good job there as well. Shapen is another one that has some cute styles. And then if we're going into more of the athletic side, especially if you're looking for something that has a little bit more cushion, there's Lems, which is kind of more of that transitional shoe. So something like the Primal Zen shoe from them kind
how do
of
you
fall
spell that brand? Sorry.
Lems, Lems.
Okay.
They're based in Boulder, here in Colorado, and their shoes, as far as cushion, kind of fall between a more traditional shoe and a minimalist shoe. So they're a nice like transitional shoe. Especially they have a shoe called the Primal Zen that I recommend quite often. But if you're wanting something that has a little bit more cushion, especially for like running,
Mhm.
Ultra is a great brand that has that nice wide toe box, but that has more cushion. Again, this could be a nice step down shoe if you are coming from something like a max cushion shoe and you're trying to step down a little bit at a time. This is the Escalante, another great shoe.
Someone is just asking in the comments here if they do currently have plantar fasciitis, uh, are these type of shoes recommended right away?
So every case is different, and that's so hard to say.
Mhm.
It depends on the severity. Like going back to that conversation of if we're at a point where you can barely walk, then
Mm.
I would be trying a little bit more cushion in the beginning just to see if that helps. But if you've done that, if you've tried the more cushion route, then let's try the opposite. Let's try going down a little bit. It's gonna challenge your foot more, but if we do it in that smart, really conservative, build up kind of way, it can be really helpful. So I've had patients that I recommend going minimalist, and I've had patients that I recommend let's add a little cushion before we make that transition while we build up strength. So unfortunately, I don't have a one size fits all answer for that
Yeah,
one.
and that might be best discussed with your healthcare practitioner then for sure. Another question, someone asks, I have Morton's neuroma. You know what that is? In my left foot. It started a year ago from poorly fitting shoes. I'm doing toe exercises, wide spacers, wide toe shoes. Will it ever go away?
Oh, such a hard question. And I'm
Mhm.
so sorry that you are dealing with that because neuromas are not fun. So
So
for anyone
what is Morton's neuroma, if you
So
could
for anyone
explain
who
that?
doesn't know what a neuroma is, there are nerves that run in between the metatarsal bones that go to our toes. And over time, if those nerves become irritated, whether that's because they've been compressed laterally, so think footwear, or because of compression downwards, and that can kind of come to different mechanics types. Um, but whether with that compression, the nerve starts to get irritated, and nerves don't like irritation. So what they start to do is they start to thicken that wall around it. And over time, it creates this bump, which is called a neuroma. And the worse the neuroma gets, the thicker it gets, but the easier it becomes to compress. So you really want to intervene early with neuromas. Now, it sounds like you're doing a lot of the right things. Toe spacers is the first thing I recommend. Wide toe box shoes is the second thing. And then working on spreading those toes. So again, doing your lift, spread, reach, adding in the toe strengtheners, anything you can do, but then also figuring out if you are putting compression downwards into it. Many times, for example, this is just one case, but people who have chronic ankle sprains tend to push off when they're walking and running off their outer toes instead
Mm,
of pressing through their big toe. And when we're pressing off those outer toes, those outer metatarsals aren't designed for the same amount of load as this first metatarsal. So that can be one of the reasons that we get that downward compression. So I would look at the mechanics and see if there's something there. And then the last piece is offload it. So using something like a metatarsal pad or a shoe that does have a little bit more cushion or forefoot rocker so that you can roll over the shoe and not irritate it while it's inflamed. The question about whether it'll go away, neuromas don't usually go away, but they do get better. And
mm,
it's the same conversation with bunions. We can't guarantee that they're going to go away, but you can improve the function and decrease the pain. And that's really what's going to change, when it comes to lifestyle.
absolutely. We have another question here.
Mhm.
And someone says, should those who pronate, that's turning inward, also wear minimal support shoes? If yes, even with running?
Great question. I love this. So, pronating got this really bad rap, just like flat feet, for many, many years. But pronating is a totally normal motion of the foot. When the foot comes down and hits the ground, it has to pronate or kind of unlock, if you will, in order to shock absorb. But the key is that then it needs to get out of pronation. It needs to be able to push off. And when we push off, we should see that arch raise back up.
Mm,
So I like to caveat this with let's not demonize pronation because pronation is a good thing. We just need to be able to get in and out of it. But going back to the question about footwear, a really interesting thing about footwear, I'm going to go back to the toe box for a second because, and this will definitely be a better visual for those watching, but when you look at the foot, the arch, the medial longitudinal arch of the foot is in a beautiful position when the big toe is in alignment. But the second you take the big toe and you push it towards the other toes, you can see the gapping that occurs on the inside of the foot. You're basically taking that arch and trying to push one of the legs, like imagine a real arch out in architecture or whatever, and then you take one of the legs and you try to sweep it out from underneath it. The
mm,
arch is going to collapse.
mhm.
So if that feels like it's what part of what's happening, then getting into toe spacers, getting into a wide toe box can actually help restore the position and the stability of that foot.
Someone else had asked a question here. They just said, what about drop in athletic shoes? And I think you're going to just say no drop, zero drop is going to be ideal because the minimalist shoe is ideal. Yes?
Yeah, zero drop is going to
Yep.
be ideal because it's going to equalize the weight distribution from the forefoot to the rear foot. The The problem with wearing a high drop shoe over time is that the tissues on the posterior chain can actually shorten. So it can actually limit your ankle dorsiflexion if you would have long-term use of a heel to toe drop.
Okay, this will be the last one here for you, Dr. Jen. She says, my podiatrist created custom orthotics a few years ago. My plantar fasciitis, I couldn't walk without shoes or far before the orthotics. I now have no pain walking barefoot. I can walk miles with my orthotics. Should I consider a minimal shoe without orthotics?
The one thing that stands out to me, first of all, I love that you got orthotics and that it helped your pain. Like I am not anti-orthotic by any
Yeah.
means. They are a
Yeah.
tool in the toolbox to help you as needed. But the thing that stands out to me about what you just said is that you go barefoot without pain. And
Mm.
that's an indicator to me that we may not need those orthotics. The orthotics are the crutch, right? They get us through the injury, but then we want to build up that strength so that we don't need them anymore. So I would say if you're already going barefoot without pain, you may want to start building up your tolerance there and see how it goes. Because if you have the strength to not need the orthotic, then why use the orthotic when it's going to do the work for your foot?
Mm-hmm. Yeah. And strengthening the foot is the key. Jen, that was amazing. Again, you're just so full of good tips. And women, I encourage you to just put some of those exercises on repeat, right? She gave us so many good ones. If you were joining late to this conversation, be sure to go to the beginning because she laid out a bunch of different small, minimal exercises that you can do on a regular basis to really strengthen that foot, the toe, and to ensure healthy feet from here on in. We looked at, of course, the shoes, having that wide toe box, making sure that you try to transition into some sort of minimalist shoe is a good idea as well. For summer, we want to look at sandals, but with that heel strap and not ones where we're gripping with our toes. So lots of great information. I guess we're all going to go shoe shopping coming up here. Hey,
Sorry, I did want to mention as far as shoes,
yeah.
we do have a list of brands on our website. So if you go to
Okay.
gatehappens.com, it's under
Perfect.
favorite products. And like I said, there's so many brands out there, so that's an even bigger list for you.
Okay, perfect. I was going to list them because I wrote them down here, but that's even better. In the show notes, you'll find Dr. Jen's information in terms of how to work with her. Do you work with clients and patients online?
So our team does. So Gate Happens,
Yeah.
we do virtual consultations with clients all over the world. I personally don't do
Yeah.
online consultations anymore just because I'm running the entire company.
Yes, you are.
But I do see patients in person 1 day a week here in Colorado. So if anybody wants to come join me and head to the mountains for a little vacation afterwards, I'm in
Perfect.
Lafayette, Colorado at Kinetic Chiropractic.
Perfect. Yes. And all of those links will be in the show notes as well. Thanks for listening, everyone. Thank you so much for your insight, Dr. Jen. And now go move daily in your fitness, wellness, and nutrition. And we'll see you all in the next Move Daily Talks.